Thyroid hormone plays so many important roles throughout the body. It regulates metabolism, promotes tissue growth and maturation, helps the heartbeat, does wacky central nervous system stuff. It's no wonder that in the setting of hypothyroidism, the clinical manifestations are so varied and widespread. For a complete refresher on the synthesis of thyroid hormones, check out our corresponding thyroid sketch in Sketchy Farm. In this sketch, we're going to focus on the clinical presentation of hypothyroidism, as well as one of the most common causes in the developed world, Hashimoto's thyroiditis. I'd like to welcome you to the underground layer of Dr. No. Thyroid. The world's most dangerous endocrinologist. Looks like Agent Sean down here has found himself in quite the pickle. Totally pulling a Braden, am I right? Welp, nothing a few outdated gender tropes, cartoonish gunplay, and a few witty one-liners can't fix. At Sketchy, a bow tie is a recurring symbol for the thyroid gland. So, naturally, an untied bow tie represents hypothyroidism, the main feature of this sketch. When thyroid hormone levels are low, the basal metabolic rate decreases, as depicted by the bartender futilely reaching for that BMR bar. This leads to decreased heat production and cold intolerance, as well as lethargy. Other findings include dry, cool skin, brittle hair, and periorbital edema. Edema in hypothyroidism is due to the accumulation of glycosaminoglycans, such as hyaluronic acid, in the tissue. Just think of this glycosaminoglycan gag shoved in the bartender's mouth. This non-pitting type of edema is termed myxedema, hence the drink mixer held by the bartender. Myxedema accounts for the development of macroglossia, or tongue enlargement, and hoarseness. That'll keep them quiet. Patients may also complain of numbness, tingling, or pain in their hand in the first 3 fingers and half of the 4th finger, which should make you think of median nerve entrapment due to carpal tunnel syndrome. This is a fairly common finding in hypothyroidism, and is thought to be related to the edema caused by glycosaminoglycan deposition and mucinous deposition on the median nerve sheath, leading to nerve compression within the narrow carpal tunnel. Weight gain is a common occurrence in hypothyroidism as well, due to both a decreased basal metabolic rate and edema. Again, this is usually that special glycosaminoglycan non-pitting kind of edema. Furthermore, decreased thyroid hormone is associated with downregulation of LDL receptors in peripheral tissues. At Sketchy, we represent LDLs as low-density ships that shuttle cholesterol throughout the body. And in this scene, that ship is a boat. A gravy boat, carrying a cholesterol-dense load of gravy. Notice that the saucer where it's supposed to sit is broken, almost like a broken receptor. Almost, dare I say it, like a downregulated LDL receptor. See what we did there? LDLs accumulate in the serum, which leads to hypercholesterolemia, symbolized by that cholesterol-laden stick of butter. Hypothyroidism also leads to decreased gut motility, which presents clinically as constipation. One of the most common symptoms, actually. Weakness in the setting of hypothyroidism may be the result of hypothyroid myopathy, a condition that leads to muscle weakness, cramps, and myalgias. That tear in his striated pants represents the atrophy of fast-twitch type 2 fibers. These types of fibers rely on glycolysis for energy. So, as you can imagine, they don't fare too well in a state of decreased metabolism. Serum levels of creatine kinase, an enzyme normally found in muscle, are frequently elevated in these patients, represented by the CK crispy chicken up on the counter. The serum level of CK does not necessarily correlate with the severity of symptoms, however. Muscle weakness tends to be proximal, with the shoulders and hips being affected. Hypothyroidism also has a variety of cardiovascular symptoms, all depicted by the global agent of secrecy himself. Thyroid hormone normally upregulates beta receptor expression. Therefore, in hypothyroidism, there's a downregulation of beta receptors in the heart. At Sketchy, the beta-adrenergic receptor is represented by a rousing, heart-pounding beta bugle. So, to represent beta downregulation, we've drawn in a broken bottle of Beta Bugle Boy whiskey. Hypothyroidism is also associated with impaired calcium flux in cardiac myocytes. Put all this together, and you've got bradycardia, decreased cardiac contractility, and a corresponding decreased cardiac output. This can present clinically with symptoms of dyspnea on exertion. Even though cardiac output is decreased, patients can present with hypertension. Because thyroid hormone normally works to relax vascular smooth muscle, patients with hypothyroidism have an increased systemic vascular resistance, as depicted by those tight red peripheral pants. This leads to hypertension in about 20 to 40% of patients. Yep, she's angry. Take that hypertension, add on the dyslipidemia we discussed earlier, sprinkle on a little theoretical endothelial dysfunction and increased homocysteine in the setting of hypothyroidism, and you have the perfect recipe for atherosclerosis. Over time, hypertension and coronary artery disease can contribute to the development of heart failure. In premenopausal women, hypothyroidism can cause menstrual irregularities, including amenorrhea, irregular periods, and even abnormally heavy or prolonged periods. Thyroid hormone is also important in fetal development. And hypothyroidism during this period can lead to congenital hypothyroidism, also known as cretinism. Congenital hypothyroidism is most commonly caused by thyroid dysgenesis in the developing fetus, but can also be caused by maternal hypothyroidism and iodine deficiency. Classically, these patients are characterized by the 6 Ps: pot-bellied, puffy-faced, protruding umbilicus, protuberant tongue, pale, and poor brain development. In fact, congenital hypothyroidism is one of the most preventable causes of intellectual disability. On the neuro side of things, a common complaint of patients with hypothyroidism is a distal and symmetric neuropathy, consisting of sensory loss, tingling, and pain. These clinical signs of polyneuropathy usually develop in a stocking glove pattern, starting at the distal extremities. Hence the stockings and gloves worn by the woman in red. On physical exam, you may notice a loss or blunted deep tendon reflexes, represented here by our falling drink mixer that's shaped like a reflex hammer. There can also be delayed relaxation of the deep tendon reflexes. In other words, after you get the muscle to reflexively contract, it seems to relax in slow motion, a feature pretty unique to hypothyroidism. So we've added a kind of slow motion-like effect to this reflex hammer. This is an action sequence after all. Hypothyroidism can also cause cognitive dysfunction, though the pathogenesis remains unknown. Symptoms include depression, anxiety, and cognitive impairment in some cases. In fact, hypothyroidism represents a reversible cause of dementia. Now, let's talk about the most severe complication of hypothyroidism: myxedema coma, illustrated over next to the mixologist in a coma. I get it. Myxedema coma is an acute, exaggerated form of hypothyroidism that can lead to cardiovascular collapse and death. Your whole body just kinda slows down. It can occur due to long-standing severe hypothyroidism, or can occur more acutely in the setting of an acute stressor such as infection or MI. It's marked by progressive confusion, lethargy, and hypothermia. You don't have to be in a coma to have myxedema coma, but surprise, in the later stages, patients may become comatose. While typically we see hypertension and hypothyroidism, in severe disease, there can be a marked decrease in cardiac output and hypotension. Some studies have shown an association with hypothyroidism and hyponatremia, and it's especially prevalent in the setting of myxedema coma. Half of patients are hyponatremic, probably due to decreased excretion of free water by the kidney. These very low sodium levels can contribute to altered mental status. There can also be hypoglycemia, which can be due to hypothyroidism itself or from adrenal insufficiency. And if you remember from the adrenal sketch, acutely low cortisol levels can cause a so-called adrenal crisis, also a medical emergency. Why do we see hypothyroidism and adrenal insufficiency together in some patients? Well, patients can have autoimmune hypothyroidism with a corresponding autoimmune adrenal disease, or if hypothyroidism is due to a dysfunctional hypothalamic pituitary. The adrenals may be involved as well. So all in all, double whammy and bad news. Myxedema coma is treated with IV thyroid hormones T4 or levothyroxine and T3 or liothyronine, as well as high-dose corticosteroids. Mortality can be as high as 50%, but luckily, myxedema coma has become much less common due to early detection and treatment of hypothyroidism. All right, on to diagnosis. Time to see what these nefarious villains have in store for our worldly guy of inscrutability. To diagnose hypothyroidism, we first check a TSH level as it's the most sensitive screening test. In the setting of primary hypothyroidism, when it's the thyroid itself that's malfunctioning, TSH will be high. Makes sense. The thyroid is pooped, and the pituitary tries to wake it up with more thyroid-stimulating hormone. As you know by now, our recurring symbol for the thyroid is a bow tie. Thyroid-stimulating hormone, then, is represented by a guy tightening his bow tie, stimulating it, if you will. And to designate primary hypothyroidism specifically, we've placed our villain next to a number 1 table marker. All right, we've got high TSH. What next? Well, if you've been doing your homework, you'll recall from Sketchy Farm that the thyroid releases both T3 and T4. T4 in greater quantities. T4 is represented by a T4 time bomb set to 4 minutes. The more potent form of T4 is T3, and most of this conversion occurs out in the periphery, represented by an activated time bomb counting down from 3 minutes 59 seconds. So back to the action at hand. In the setting of primary hypothyroidism, TSH should be high. Next, check that T4 level. If it's low, you've got yourself hypothyroidism, as illustrated by our inept henchman here, confidently tightening his bow tie as that T4 time bomb drops to the floor. It's his first day on bomb duty. Rookie mistake. Side note, T4 can also be normal. This can be seen in the setting of subclinical hypothyroidism. Subclinical disease means it's concealed, not showing any symptoms, just